New York Conference Health Commission COVID-19 information session. We would like to thank all of you for joining us this evening. I first of all want to recognize our presiding elders. I'm a little biased, so I'm going to recognize my presiding elder first, the Reverend Dr. Linnell Guyton, who is the presiding elder of the Brooklyn Westchester District. I really want to thank Elder Guyton for being the one that planted the seed. He reached out and he said, you know, Reverend, we got to have this conversation. And I want to thank our other presiding elders, Elder Ron McCune of the Manhattan District and presiding elder Joanne Owings of the Jamaica Long Island District for coming together as a conference to have this much needed discussion. As we proceed tonight, we have an hour and a half. It seems like it may be a long time, but for this topic, it's a short time to get you the information. We have decided to run this as a town hall where we are going to begin with some pre-questions that we have put together. But what I'm going to ask you to do is to, first of all, remain muted throughout the presentation. You can use the chat room to begin to put your questions in. We will be monitoring the chat rooms, and as your question comes in, we will deflect from the pre-prepared questions to get the discussion started, and we will take the questions from the chat room. This is a space, no question is ridiculous. No question is, don't be shy. We really pulled this information session together to dispel some myths and to bring you the facts as current as they are today. I want to take this opportunity to introduce my colleagues who will be assisting with their areas of expertise this evening. I want to recognize first Reverend Dr. Miriam Burnett. Many of you know she is the medical director of the International Health Commission of the AME Church. She is also president of RAFA, which stands for Resource and Promotion of Health Alliance. It is a nonprofit health education and promotion consulting company. She's a graduate of Morehouse School of Medicine, where she received her doctorate in medicine as well as her public health degree. She is currently serving as the pastor of the historic Jones Tabernacle AME Church in Philadelphia. Our second presenter tonight is Dr. Wieda Collins. She is a board certified family medicine physician. She obtained her graduate medical degree from Meharry's Medical School. She also has her master's in public health. Currently, Dr. Collins works as a hospitalist physician in Louisiana and Tennessee. She has been on the front lines of this COVID-19 pandemic from the very beginning to this current day. Unfortunately, Dr. Ovetta Fuller could not join us this evening, but we have Reverend Natalie Mitchum, who many of you know is the executive director of the International Health Commission of the AME Church. She is a registered dietitian nutritionist. She is currently a doctoral candidate for education leadership at the American College of Education. She is a health and nutrition manager for Head Start, Early Head Start Preschool, majorly responsible for all of their COVID-19 guidelines. Amen. And I am the Reverend Dr. Lisa Williamson. I am the first Episcopal District Health Coordinator. I am a retired pediatrician, but since this pandemic, I have decided to become part of New York City Health and Hospitals contact tracing. I am currently a supervisor there, monitoring a team of contact tracing New York City, as well as overseeing a second team that handles air travel into JFK for domestic flights. I come to you this evening excited about what we are doing tonight. And as I said before, I'm going to ask everyone to remain muted. And please, you can begin to put your questions in the chat room. What I want to do to start off is just to give you what I call a landscape. Currently, globally, there are, as of 4:20 p.m. today, I told you we are real time. As of 4:20 p.m. today, there are greater than 112 million confirmed cases and greater than 2.4 million deaths globally. Today alone, globally, greater than 420,000 new cases across the world has been reported. We bring it to the United States. As of today, there are 28.4 million confirmed cases. Many of you know that this week we hit, and today we have already superseded the 500,000 mark, where today we have over 507,000 deaths reported in the United States. I'm going to bring it a little closer to home. And I want to share with you the current status today in New York City of the COVID-19 vaccine. As of today in New York City, of the 5 boroughs, there have been over 2.3 million doses of the COVID-19 vaccine delivered. Of those 2.3 million doses to date, there has been over 1.6 million doses administered. If we go down, you will see that currently on hand, New York City has less than 189,000 doses available to give as the first dose, and they have less than 237,000 on hand to give as the second dose. I want to bring it a little more closer because this is the reason we are here this evening. To date, in New York City, we have over 380,000 people who have been partially vaccinated. And now we have over 430,000 people that are fully vaccinated. When you look at the non-New York City, which takes up Westchester County and parts of Long Island, we have over 84,000 people partially vaccinated and 144,000 people who are fully vaccinated. When you break it down by race, you will see already, and I know many of you have been already hearing about the difference in the vaccination rates among the races. Right now, to date, from 18 to 64 years of age, 37% of white people, communities have been vaccinated. If you go across the board, for seniors 65 and up, it is at 42%, and for all, it is at 44%, and for all, it is at 42%. When you look at our Asian brothers and sisters, they're the second group at 19%, 13%, overall 15%. Our Latinx brothers and sisters are third at 17%, 15%, and 16%. African Americans, we are at 11% for ages 18 to 64, 12% for 65 and older, and 12% for all adult cases. I just want to show you outside of the 5 boroughs, the numbers are even more dramatic. So in parts of Westchester County and Long Island, you're looking at 53% compared to African Americans at 7% and Latinx at 9%, and Asians at 11%. This is the current landscape, and this is why we are here this evening. Many of us are very aware that Black and Brown communities have been impacted by this COVID-19 at a higher rates. And now that we have a vaccine on board, we are not being vaccinated at the same rate as other communities. So I want to begin this discussion first with a disclaimer. And from the International Health Commission, which is also the disclaimer for the First Episcopal District and the disclaimer for the New York Conference Health Commission. The opinions, responses, and information shared by the professionals, experts, and the International Health Commission, New York Conference Health Commission today during all informational webinars does not replace individuals having a conversation with your medical provider. And if you do not have a medical provider, you can call 311 in New York and be attached to a provider, especially related to COVID-19. We understand that some individuals may not have that provider. If you have questions, you can reach out to that provider hotline at 311, or you can have a conversation with the personnel at the site you may be going to before you receive your vaccines. The goal of our webinars, town halls, and all that is posted on our International Health Commission website, amechealth.org, is to provide individuals with information to empower you to make informed personal decisions regarding all topics presented by the Commission. So at this time, I want to start the discussion. We have painted the landscape, and now I want to ask Reverend Dr. Burnett if she will now answer, what do we know about the vaccines that are out there currently? What vaccines are available, as well as vaccines that may be slated to be approved? Dr. Burnett?
Thank you very much. It's good to be with you all back in my home annual conference. Pfizer is the first one and Moderna the second one. Both of them are what's called mRNA vaccines. They use the spike protein. If you look at the screen behind Dr. Williamson, you'll see those projections. Those are spikes. And they use the spike protein to basically attach itself, and then it dissipates. But what happens is your body then recognizes that that's what it's supposed to be attacking and preventing infection. The Pfizer vaccine and the Moderna are both two-dose vaccines. They are about 95% effective after the second dose, about 2 weeks or so after. They are less effective. Well, Moderna has said that it is as effective for the UK, the variant, the South African variant. It is testing, but presumes it's a little less. Matter of fact, it's even looking now on January 25th, it launched a new trial to look at whether or not a vaccine booster needed to be developed, presuming that it would be available the fall of 2021. The third vaccine is one produced by Johnson & Johnson. It is not FDA approved yet. It will be coming the next week or so to the FDA. It's right on the heels of, that is a one-dose vaccine, and it's called a vector vaccine because it's actually attached to the to an adenovirus. Think of it as a cold virus, and that's how it gets into the system. Again, it dissipates completely as soon as it gets in your system. All three have been shown to prevent severe disease, including those illnesses that require hospitalization. But with all three, you can still be a carrier. I'll hold the rest for later.
Thank you, Dr. Burnett. We already have a question in the chat that says, should we wait for the vaccine of our choice?
You should not wait at all. You don't know whether it's going to be available tomorrow. And so you need to get whatever is available to you. There's no real difference. The mRNA vaccines, Pfizer and Moderna, do not become, let's get rid of one of the myths right off the top of the bat, does not become integrated into your DNA, does not become a part of your quote unquote system. And so all of the side effects are about the same. Fatigue, headache, chills, muscle pain, no worse headaches, no worse than if you say you got the flu.
Okay. Dr.
Lisa, there is a question. I'm not sure what PHAR stands for. We need a clarification on that, but it says, what is PHRA?
No, I'm sorry, that was me. I was saying, I'm a person with a lot of allergies. I was advised to wait to before I take the vaccine because there's been quite a few cases of anaphylaxis. And that's what mostly I suffer from when I have an allergic reaction. I was advised not to take the Pfizer and to maybe try the Moderna or the Johnson & Johnson. So my question was, which one of the pharmaceutical companies have started a trial study on those that have allergies, severe allergies?
Okay, can you all see my screen? Because I can't seem to move it.
We can see your screen.
Great, wonderful. So as it relates to the Pfizer and the Moderna vaccine, those who should not be taking the vaccine are those who have severe allergies, anaphylaxis to a previous dose. In other words, if you got dose 1 and you had an anaphylactic reaction, you should not get dose 2. Also, if you are allergic and know you're allergic to polysorbate, or otherwise known as PEG, polyethylene glycol, don't get a vaccine. Consult your allergist or immunologist. If you have had an immediate reaction to other vaccines, that means a conversation. It also means that a further risk assessment needs to be done, 30 minutes of observation and the required, instead of the required 15. And those like me who have a peanut allergy, food, pet, insect, venom, etc., history of just allergies, family history of allergies, I mean, you get a 30-minute observation, but you can proceed. Same scenario for the Johnson & Johnson, we believe, but we won't know that until it goes to the FDA.
So this is for the Pfizer and Moderna that you
Yes,
have up on the screen? Okay.
Yes, ma'am. Yes, ma'am.
Okay.
I've already had both of my doses. I have an anaphylactic reaction to nuts and had no problem. But I also held a conversation with my doctor.
Okay, and
Yeah.
I'm just going to say to really utilize the chat room for your questions and try as much as possible to remain muted. We have the question, and I'm going to give this to you, Dr. Collins. If you test positive for COVID-19, how long after should you take the vaccine?
If you test positive for COVID-19, some of it will vary about your treatment. So if you were treated with monoclonal antibodies, then you have to wait 90 days. If you received any other vaccine, you have to wait 14 days. If you had COVID-19, then you're waiting until you are symptom-free, fever-free for 24 hours. And that means without you taking any Motrin, any Tylenol, any medication, all of that for that period of time. And then you're able to receive the vaccine.
Okay. There's a question asking about the effectiveness of the Johnson & Johnson vaccine. As stated earlier, Johnson & Johnson, their effectiveness range goes from 66 to 85%. And I just want to make it clear, and we're going to address this. These vaccines, as of now, do not prevent infection. These vaccines are preventing symptoms and disease severity. So when you hear the ranges for the vaccine, and we're being very careful in our language, we're saying up to, because that is, dependent on your immune system and how you respond. So Pfizer and Moderna is up to 95%, and Johnson & Johnson is anywhere from 66 up to 85% in relation to moderate to severe disease. The next question somebody I know is going to say, so should I not get it since their number is lower? You get what is available to you when you make that appointment, because something is better than nothing, right? So you get the vaccine, and unfortunately with the distribution of the vaccine, you can shop your choice, especially if you are signing up to one of the city-run vaccination sites. And I will put this in the chat room. If you go on vaccinefinder.newyorkcity.gov, they will pull up all the sites for you, and they actually let you know which vaccine is available. And with limited appointments, whatever site you can get an appointment at, that is the vaccine that you are going to get. So right now it's Pfizer and Moderna. Actually, Johnson & Johnson is going for their emergency use authorization tomorrow. So yeah, so they should be coming on board. I see someone put in the room, if you tested positive for antibodies, should you get a vaccine? Wieda?
Yes.
Yeah.
Yes. You don't know how long the antibodies are going to last. You don't know how much protection you're getting from those antibodies. So yes, you should still receive the vaccine.
Okay. Dr. Burnett, what are the most common side effects?
We just ran through those, but fever is not one of them. That's one of the myths to get rid of. But fatigue, headache, some folks get chills, especially after the second one, muscle aches. That's it.
Okay.
And the second dose, just so you know, is more impactful than the first dose. First dose, I had you can also have some local arm swelling. First dose, I had nothing other than my arm swelled up at the injection site for 24 hours. The second one, I slept for 2 days.
And data has already shown has shown that it is really after the second dose that you see these side effects. I know that I tell people, not to schedule anything on the day you get your second dose. Dr. Collins, is there anything that we are supposed to either pre-medicate with or take before or after we get vaccinated?
No, we don't want you to pre-medicate. So no Tylenol, aspirin, ibuprofen, any of those analgesics beforehand, because we want your body to respond. We want your immune system to respond to this. And so by taking medication, you will kind of hamper that response a little bit. Even with the second dose, we don't want you taking Tylenol, ibuprofen, anything before, after. If you have some pain at the site, apply some ice to it. If say after 8 to 12 hours, just like, but this headache or whatever effect, you can consider taking something then, but we really want your body to come on and fight this. So trying to stay away from the Tylenol, ibuprofen, and all of that, definitely before you had the vaccine, we don't want you to take it. That's really kind of contraindicated and going against what you're trying to get your body to do.
Dr. Burnett, we have a question in the chat group regarding variants. What about the variants? How are they being reported? How effective are the current vaccines against those variants?
The US is now doing tracking of variants. And so there's actually a portal where if you wanted to, you could go see the count in your local area. So the count of which type and how much. And so it's worth following if you are that interested. But what's key is they believe, still testing, there is a slight decrease in the effectiveness, but it is not less than 50% at this point. So it is still important, even though they're variants, to get the vaccines. And it's still going to be important that everyone continues the preventive health measures. You still got to wear a mask. You've still got to wash your hands. You still got to physically distance, all of that.
I just want to say there was a New York Times article that came out yesterday stating that they believe, it has not been peer reviewed, that there is a New York City variant. New York City variant. They are doing more research on it, but it is something that they have identified thus far, and it is still being researched. Somebody always say a variant, and I just want to a variant is a mutation, right? Because this virus mutate, it changes itself. What is the most common reason this virus will mutate is when you gather.
Right.
Because when this virus comes into contact with people, it adapts itself. So that's why we're saying, because people believe that once you get vaccinated, and I'm glad Dr. Burnett talked about still maintaining all the social distancing guidelines, the vaccine is not here for you to get a false sense of everything's normal with me, I can go hang out. We should be running back into our churches, because the variants now are becoming more rapid because of gatherings, and the mutations are coming because we are gathering. There's a question, Dr. Burnett, about the risk benefits of vaccination for people with autoimmune illnesses.
There is indication that people with autoimmune diseases were actually included in the studies, initial studies, and were found to have benefits. Specific risk benefits depends on which autoimmune disease, what is your status in terms of your own personal immunity. And so this is one of those categories where you definitely need to speak to your provider.
The other question, is there a certain underlying health condition, any particular health condition, which a person should not take vaccines other than allergies? And
No.
we've addressed that, no.
Right. No.
The question for you, Dr. Collins, is I know we're talking about the vaccine, but I wanted to have you just talk a little bit about what happens when someone is hospitalized with COVID-19.
Okay. So generally what will happen when you come into the hospital, certainly the persons that are hospitalized have increased symptoms. And they can range anywhere from respiratory symptoms such as shortness of breath or wheezing, inability to breathe, even to GI symptoms where there's diarrhea, stomach upset. The big thing is we focus a lot on the respiratory symptoms because this is a virus and it does kind of affect the respiratory system. But what you have to understand, what makes this so deadly, it's not just going after the respiratory system, it's trying to kill you, everything in you, your heart, your lungs, your kidneys. We don't talk a lot about that. The majority of the people that end up in the hospital end up on dialysis because their kidneys are trying to shut down. Your blood starts to thicken and there's clotting. So we're trying to keep you from clotting and throwing clots that will go to your lungs and kill you, or go to your heart and cause a heart attack, or go to your brain and cause a stroke. So that's our focus in the hospital. We're focusing on two things: to keep you alive and try to keep you off the ventilator. But if you are having to be ventilated, this is not just a little oxygen up your nose. I'm going to take a blade and stick it all the way to the back of your throat and take another tube and wait on your vocal cords to open and slide that in between, and then put you on life support. That's what we're talking about with ventilation. You know, that's life support. We're going to try to set the machine to breathe for you. We're going to try to give you so much oxygen, but that's not going to save you. We can give you 100% oxygen, but people still may die. And so when you go in the hospital, those are our biggest things. Plus, we have to deal with any other comorbidities that you may have, your diabetes, your hypertension, your heart disease. And so we're really, one of the things to help prevent you from getting there is to make sure that those comorbidities are controlled. But the bigger question that comes in that I have to ask families or whomever's there, or even you, if your heart were to stop beating or you were to stop breathing, do you want me to try to resuscitate you? Meaning, do you want me to put you on life support and do chest compressions? And you have to make a decision. And we need to know that before. A lot of times people want to, you know, oh, well, let me call somebody. I may not have time for you to call anybody. So those are things, even outside of COVID, that you need to discuss. And if you're not able to make that decision, then who? And so you need to have that placed, you know, when you come in on the chart, and that needs to be updated. Because people will say, oh, they always go to that hospital, but we get phone numbers that don't work or they've been cut off, and you have a new cell phone. So you want to make sure that you have that. You can also have someone legally that's there to make decisions for you. So you can have a health proxy where you go and have the paperwork filled out and they are able to present it. In some states, if you don't have that, then there's a decision line that's made. It's first is the spouse, and that is the spouse, even if you have been separated for 100 years, but you're not divorced, it's the spouse. After that, a lot of times it's the oldest child or a consensus of the adult children. So you want to have those decisions in place, but also we're going to treat you, you know, we're going to treat your respiratory problems. You'll more than likely, if you're in the hospital, you're going to need some oxygen. We'll do respiratory treatments. We'll give you steroids. We'll give you antivirals. You may be treated with monoclonal antibodies. You may end up with dialysis. And like I said, that happens more than what we talk about. You're definitely going to have anticoagulants, things to try to thin your blood, to try to keep it from clotting. So all of this goes on, and understand this is a rapid cascade of events. And you can be well and think you're okay. I tell people, I walked through the ICU one evening, and there was a gentleman, I had seen him that morning. He was fine. I thought I was, you know, I was going to put him on the regular floor probably the next day. And I just poked my head in because, you know, his door was open. You okay? Yeah, doc, I'm fine. I'm just sitting here watching TV, about to eat dinner. And I said, okay, I'll see you in the morning. When I came back in the morning, he wasn't there. I thought maybe they had missed him off my list or something like that, but he died. And more than likely from the clot, because they will come aggressively and will just take you out. So essentially, that's what goes on in the hospital. And hopefully, you survive all of that and that we're able to discharge you. Some people have so much fatigue and physical decompensation that they have to go to rehab and those types of things. So when you gather, decide not to wear a mask, or sing with the praise team without a mask, and y'all haven't been tested or share mic, understand that's the risk that you're taking, is to come to see me. And I always tell people, I'm not generally the doctor people want to see more than once.
Thank you, Dr. Collins. And the reason that I really have Dr. Collins include this is because it is to dispel. There are still sections of our community that believe this is a hoax. My daughter sends me TikTok videos all the time where I see people that look like me and you saying this is a hoax, it's a conspiracy, it's not real. So I always like Dr. Collins to paint that realistic picture to let everyone know this is not a hoax. A question for you, Dr. Burnett, is would you suggest having a COVID test prior to taking a vaccine?
I would not. It won't make a difference, and let the guidelines say if you are symptom free and you are not in an incubation state, that you would go ahead. So there's no point in taking a test before.
Another question is, should you take the vaccine, Dr. Burnett, if someone is receiving chemo or radiation treatments?
Yes, there's also a conversation to be held because there may be less of an immune response, but any immune response is better than none.
If someone is allergic to penicillin and has COPD and tested positive, should they wait 90 days to get the vaccine?
No. Again, it's if a person has symptoms, they have to be symptom free and out of incubation period, then they can get the vaccine. The 90 days comes from anyone who has received the convalescent plasma or monoclonal antibodies.
Dr. Collins, how long should someone expect those symptoms, side effects of the vaccine to last?
The side of the effects of the vaccine in most people resolve within 24 hours. But it can last as long as about 3 days with improvement after that. And like we've said, a lot of times it's after the second dose. You have some people with some symptoms after the first, but generally after the second, because at that point, your body is aware of the vaccine and your immune system kind of kicks in. But the symptoms generally resolve in 24 to 36 hours or less.
There's a question here regarding booster shots. Yes, many of you may have seen the news headline today where Pfizer is thinking about a possible third dose booster. They are thinking about booster shots because of these variants. And as they are testing the efficacy of the variant, they may decide to give a booster shot. But I want to just emphasize something. We have only had these vaccines and people vaccinating for 2 months. So a lot of the research is still unfolding. I personally think that the information that's coming out for 2 months, because there's one thing to say the vaccine, but when it gets into the arms of people, now we have to see and test how it's coming along within the population that is being vaccinated. So some of the information is unknown because it's still being researched, because it's only been 2 months. And what I want to emphasize, especially for us, the unknowns are there because this is a vaccine, and the vaccination is being done in real time. Like we're learning and researching while we're in the middle of it, unlike other vaccines which have been pre-established, your measles, your tetanus vaccines. They've been around for years. So this is a real-time vaccine, and we are still unfolding, and it's been 2 months. I keep telling people, because someone said to me, how come we don't know this? And how come we don't? It's been 2 months since we've actually started turning the vaccines into vaccinations. There is someone that said that her—
Before you move from that, I
mhm.
think it's important to note that the mRNA technology is not new technology. It's been around for a long time. So when people say, oh, we got quote unquote warp speed, and so we don't know what we're talking about, don't know what we're doing with this because it's new technology, that is not correct. This technology has been around for a very long time.
As well as Johnson & Johnson, where they're using a vector virus like the adenovirus. That technology has been around also. Some of the vaccines that you have already received use that vaccine. On the note of that, people say, are you giving me the virus? No, we are not. The vaccines are not giving you the virus. It is not what we say a live vaccine like the measles vaccine. It is not that. It is the genetic material. And it, as Dr. Burnett said earlier, it does not incorporate into your own DNA. Someone has an interesting question in the chat that her friend was told at a registration site for a vaccine that she should not have a mammogram until 1 week after her vaccination. Dr. Collins or Dr. Burnett, any understanding as to why that would be?
Yes, it is being recommended that you wait about 2 weeks or so after you had your vaccine before getting a mammogram, because there is some lymphadenopathy that is noted a little bit, and that would be normal because your lymph nodes work with your immune system. But they're showing, on the mammogram, and we don't want you to have a false mammogram or a false positive. So waiting for that to give that opportunity to resolve and then to have a mammogram is best. But certainly if you find a lump or you have drainage from your breast or discoloration, then you still go on and go to the doctor, okay? But that is a recommendation at this point.
There's a question in the chat that I am going to take. Is the vaccine available to all age groups? The Pfizer vaccine is authorized for 16 years and up. The Moderna vaccine is authorized for 18 years and up. Both companies have started their trials in pediatric populations, meaning that they're starting to look at children 12 years and under. And what they do not create a brand new vaccine. They take the existing vaccine and they begin to what we call the doses to see if children 12 and under need a different dosing than adults, maybe half the dosing. If they're going to need more than 1 dose, more than 2 dose, more than 3 dose, are children going to need boosters? Pfizer is optimistic, and I was reading up on it last week, that they're really trying to get their authorized use for 12 and under in anticipation of the new school year in the fall. But right now, the youngest age group that can receive it is age 16. There is someone, Dr. Burnett, that stated they have a form of sickle cell. Are they qualified to get the vaccine under the underlying condition distribution requirement?
Yes. In particular in New York State, there are some variations around the country, but for New York State, sickle cell and any variation thereof are listed under that which is in 1B.
Dr. Collins, is it optional or mandatory for people to take the vaccine?
It is optional. It's optional. We want you to make an informed decision, but it is optional.
I am just going to pause. We have some background noise. Please just check your computers to make sure that you are muted. Thank you. Is it true, Dr. Burnett, that people with multiple sclerosis cannot get the vaccine? You're muted.
I've not heard that. Dr. Collins, have you heard that?
If you have multiple sclerosis?
I have not, but on that one, I would, defer you to your primary care physician or your physician with that. And so I would speak with them, but I have not heard that was a contraindication.
Dr. Burnett, someone wants to know, is Pfizer better than Moderna? Is Moderna better than Pfizer?
Go get a vaccine.
As we said, whichever vaccine is available, get that vaccine. Dr. Collins, what is herd immunity? We hear a lot about herd immunity and we have to get to herd immunity. Can you explain that?
So what they're talking about with herd immunity, meaning that there are enough people that have been immunized that has decreased the chance of the virus, decreased, not eliminated totally, but decreased the chance of transmitting or getting an illness. And that because that has happened, then the virus is not available to be transferred to persons that may come into your community that are not immunized against it. And so that's what we're looking at, a herd. But I will tell you this, you cannot get herd immunity if you don't have the herd there. Meaning, if the people have died or they're not vaccinated, we won't get herd immunity. The virus has to have someone to transfer to in order to continue, which is why we say don't gather, don't social distance, because if we don't, get together, then it can't go anywhere. But you also won't get herd immunity if there's not a herd around, because the herd has been thinned out because the virus has taken us out.
There's a question. There is a syndrome that is currently being researched called long haulers syndrome. And these are individuals who were COVID-19 positive, and they're experiencing what's considered now long-term effects. One of it is something called brain fog. So one of the questions in the chat, Dr. Collins, is, will the vaccine clear up the effects, those long-term effects of COVID-19, like brain fog? We have COVID-related diabetes. Will vaccines clear those up?
I don't think so. Because the vaccines in general are there to prevent. And so once you are a long hauler, we're not necessarily we can't prevent what has already happened the first time, because you can't get COVID again. So that the long haulers, these are some of the long-term effects that are happening. And some people eventually, after an extended period of time, will regain their strength, the fog will clear up. But at this point, we don't know how long that will last in some people. For some, they have the fatigue, they have to use a walker, and physical therapy, it resolves and they get better. They have shortness of breath and I can't hardly get up the stairs, and that's extended for some. And then as time goes on, weeks, sometimes months, it resolves. But the thing is, we don't know how long that long haul is going to last. And we don't know if it will eventually stop for everyone. It may not. And certainly some of the damages that are from coronavirus, the damages to the lungs, the damages to the heart, some of those things cannot be corrected. And so those symptoms of the effects for the things that can't be corrected will continue on. And the person will have to try to use medical management and other interventions to make their life better, but they still may have those issues.
I'll take this question in the chat. Can infants come down with COVID-19? Absolutely. The youngest case that I have seen thus far in contact tracing was a 5-day-old infant. Infants, all ages. This disease is no respecter of age. We do have more older age groups that are more impacted. We have age group that suffer more morbidities and have to be hospitalized, but this vaccine can be transmitted to all age groups. Do you, Dr. Burnett, do you have to get the vaccine every year? And how long does it take for the vaccine to take effect?
I'll take the second question first. It takes about 2 weeks after the second dose, if you're talking about Moderna and Pfizer vaccine. The presumption is, and we'll know tomorrow, for Johnson & Johnson, that it is that same 2-week time period after that one required dose. Will we have to get this every year? We're not sure yet. We don't know how long the immunity is going to last. It is one of the things that they are investigating. Is it going to be like the annual flu shot? Is the question on the table and being researched.
Dr. Collins, if you already had COVID-19, if you've already gotten the vaccine, can you be infected with COVID-19?
Yes.
Yes.
So, yes, if you have had COVID-19 before, you can get COVID-19 again. Understand that with vaccines, this is like any other vaccine. It decreases your chance of getting that illness. Or if you get that illness, it decreases your symptoms and the severity of your symptoms. So kind of like the flu shot, it does kind of help prevent you from getting the flu, but you could still get the flu. But if you get the flu, then your symptoms should not be as bad as they were if you had not had the vaccine. So this is the same with COVID-19.
There's a question in the chat saying that with all age groups at risk for COVID-19, why are schools anticipating opening? Well, research has shown that the transmission of the virus within school setting is significantly lower. And Reverend Natalie, you can jump in with this question as well in regards, since you're directing a Head Start program. The understanding that is out there is that research has shown that the transmission within certain schools, their transmission is less. I want to put a caveat here. Those schools are the schools that have the budget to offer PPE effectively, to make sure that the COVID-19 guidelines and children are staying out because they're testing, they have the right staffing. So this reopening of schools, because of the research saying that the transmission is less, it is dependent on the school district. It is dependent on the resources coming into the school district, because we know private and parochial schools have larger budgets to cover PPE than public schools. Reverend Natalie, do you want
Yes, yes, to add to that, I do agree. So for example, for our program, the parents are not allowed in the center at all. All of our staff are to remain in their own classrooms. We do not congregate in hallways. We do not congregate in libraries. We do not congregate in offices. If we have to meet, we meet by Google Meet for large groups. And then not only that, to enter the buildings, you go through a screening. The screening says that if you have a cough, there's just a list of it, and you can't even come into the building if you have any one of those symptoms. So that's at the door. Then from there, we have masks, we have goggles, we have face shields, we have gowns. We are, as she said, for our program, we're able to afford it, and the children have masks. So for those programs that are there, that have those resources, that is in place. But as Dr. Lisa said, some don't have that. And we are at high priority with those PPEs. Everyone must keep your mask on at all times. You cannot gather at all even in small groups, we discourage that. If you have to eat, because our staff does have to have lunch and the children, we have barriers for the staff to be behind in order to eat. So when you're thinking about gathering and everybody taking off your mask, that is absolutely forbidden within our centers. So I do agree with you. It depends on the budget, and you absolutely have to have a high level and a high stock of personal protective equipment for all of your staff and all of your children, and that is a struggle for many school districts.
Just to follow up, the question, if infants can get a vaccine, can infants get a vaccine since they can come down with COVID-19? Every pediatric trial right now is being done. We're not really going to have the answers to pediatric doses. Like I said, Pfizer is thinking that by the new school system, they may be able to offer it to ages 12 and under. So the pediatric trials in the various age groups are still being researched as we speak. Dr. Burnett, a question. Can a pastor require members and staff to get vaccinating, or ask their congregation or staff if they've been vaccinated?
One word answer, no. No, it's a violation of privacy.
Right. Exactly, because even what we're doing here this evening, we're giving you the information as a pastor, because I know some of my congregants, we put out the information, we give you the best up-to-date facts, and the decision is yours, but cannot be mandated. Dr. Collins, if you have had COVID-19 before, is it possible you can get it again?
Absolutely.
And some of the questions are repeating, and I'm asking it again because we need to say it over and over again. One of the issues I want to bring up, many of you know that within our Black and Brown communities, we have a mistrust of the medical system. And the mistrust, we can say, can majorly stem from the 1930 Tuskegee syphilis experience. There was another syphilis experiment in Guatemala. So we know that as a community, there is an inherent mistrust with the health system. Dr. Collins, how's the best way to address those who have that mistrust with the medical system?
So, we have to say, and there's an understanding that, the medical or healthcare system has not gained the trust of Black and Brown people. But when we start, people always go back to the Tuskegee experiment. And what I generally tell people is that they didn't give the people syphilis. The people had syphilis before they came. What they withheld was the treatment of the syphilis and not telling them. So they didn't give them syphilis. So we're not giving you COVID. Okay, so this is the vaccine is there to help prevent. And I know a lot of people are saying that, you know, it's the government is going to do this, and understand. I think what we have to understand that this is a pandemic. This is not something that is localized in the United States. Pandemic means it is worldwide. The worldwide governments can't get together to be nice and say hello to each other. They definitely didn't get together to come and put this together. Okay, so let's put that out and negate that part. And if they were just coming for us, then people who do not look like us would not have blocked off traffic in Houston, Texas, and in other areas, and coming into neighborhoods that they would not go into to get this vaccine. Okay, so there's mistrust, and I understand that. Do your research, talk to your physician, and make a decision. But I will tell you that, you know, people aren't wearing masks properly. You know that. Some of us on this line are not wearing them correctly. Some of us are still gathering, and we're making every excuse for doing that. And so as long as that's going on, this virus is going to spread, which, you know, you kind of put us in a situation that, you know, we had no choice but to get a vaccine, because we're at more people dead in 1 year, from an illness than the number of people that died in World War I, World War II, and the Vietnam War all together. And that's in 1 year. If we keep going at this pace, remember we talked about herd immunity? There won't be a herd, okay? So, you know, you got to weigh your pros and cons. Take out a sheet of paper, put down your concerns, put down the benefits, and make a decision.
I think it's also important to add to that this time around, we know many Black and Brown who were involved in the development process. And our own Dr. Ovita Fuller sat on the FDA advisory board for both Pfizer and Moderna. I don't know if she's sitting on Johnson and Johnson.
I think she is.
But we have key, I think so.
She is.
We have key people looking and watching and covering our backs.
Dr. Burnett, can your job make you get the vaccine?
In New York, no. Is it coming? Potentially, yes.
Okay. I'm pulling up more questions as I go through the chat. If one has had, Dr. Collins, if one has had COVID-19 and still has antibodies, do they still need to get, this one says a second shot, but if you've had COVID-19 and you have antibodies, do you need to get the vaccine?
Yes, absolutely.
Oh.
Again, we don't know how long those antibodies last. At one of the hospitals that I worked at, you know, before the vaccine came out and all that, we know that we all were exposed. I mean, I was in New Orleans. It hit, and it hit hard. The entire hospital became a COVID unit. And they tested us for antibodies, you know, those of us who worked there. And out of hundreds of people, maybe 1 or 2 people were positive. And so, you know, they retested a few, and, you know, a couple of people had some antibodies and that type of thing, but you don't know how long they were going to last. And they did test some people who actually had COVID-19. And so it really depends. So yes, you should still need to be vaccinated.
And I'm going to combine these questions. Someone wants to know, should they take their regular medication if they're going to get vaccinated? If they are on low dose aspirin, should they take the vaccine? Dr. Burnett.
Yes. You should not change any of your medications without discussing it with your provider. And all of the studies included people on multiple different kinds of medications. So yes. So if you're
There's a question. Oh, sorry.
I'm sorry. I saw one question that said, if you're hypertensive or have high cholesterol, should you take the vaccine? Yes.
And that gives you the underlying condition criteria. You meet it. The other question I have is, I just want to reiterate, Johnson & Johnson they are going for their emergency use authorization tomorrow. They are not currently available yet as another vaccine option in the United States. The World Health Organization authorized the use of AstraZeneca's 1 dose, but that has not been authorized in the United States. Johnson & Johnson, after they meet tomorrow with the FDA Advisory Committee, we're expecting by next week, we should hear their decision for the Johnson & Johnson. Johnson & Johnson has not done pediatric trials to date. So right now, Johnson & Johnson is not authorized. Therefore, it cannot be used for the pediatric population. So someone wants to know, this goes back, if they're on an asthma inhaler, should they take it the day of their vaccine? Dr. Burnett, I think we hit that one.
Absolutely, yes.
Yes.
Do not stop any of your medications. I don't care what the route is, without talking to your primary care doctor.
Someone says, if I already have or had or do not know if I've been infected, will the vaccine work? So I'm thinking this person is asking if they don't know their COVID status, will the vaccine work? Dr. Collins?
Take the vaccine. Take the vaccine. As we talked about before, we're not recommending that you go get a COVID test prior to taking the vaccine or to determine if you're going to take it. So in that instance that's described, yes, go take the vaccine.
Someone was indicating that their medical provider could not give them the vaccine. Understand that the Pfizer vaccines has very extreme refrigeration requirements that in most private doc's office, their fridge or freezer cannot store the Pfizer vaccine. That is why you're seeing the pharmacies are being used at vaccine sites. You have health system, you have city-run Department of Health's pop-up sites, because I know for me, as a pediatrician who gave immunizations every day, I could not refrigerate the Pfizer vaccine with the refrigeration. Moderna does not have, and Dr. Burnett showed the slide, their refrigerating temperatures is a little less than Pfizer, and Johnson & Johnson, if it is authorized, they're even less. They're saying that they can be refrigerated with a regular freezer. So the refrigeration guidelines are one of the major differences between the vaccines. Someone says that they have hypothyroidism and they're taking Synthroid. Am I considered to have an underlying condition?
I'm getting ready to put the list in the chat.
Yes.
Yes.
I'm concerned about my teenage children who are resuming outdoor sports. Yes, we know, especially in New York City, that we have been authorized to resume sports, understanding that even within sports, those guidelines have to be maintained. These Pfizer is only authorized for age 16. I would have a conversation with your pediatrician or your family doc, whoever is in charge of the care of your children. If you don't, you can call that provider hotline at 311 and ask for the provider hotline. And there are doctors that are staffed just to answer your questions. You do not have to have an established relationship with them. But this is one of those, you have to know your children's health status. Does your child have an underlying condition? We keep thinking that hypertension, diabetes is just something that adults are faced with, but obesity is an underlying condition. And with the rise of obesity within the pediatric population, we are now treating children with high blood pressure, high cholesterol, initial heart disease. So have the conversation with your child's doctor regarding whether, just because they made sports available, and something I want to talk real quickly about with children, and this is a whole nother town hall that we're going to get, is mental health, right? Nightmares, night terrors, oppositional defiant behavior, rebellious behavior. We are seeing an increase with young people, especially adolescents. Think about it. You have adolescents, they are in the prime of their socialization. Socialization is key for them. We have locked them down because of this pandemic. If we keep them only virtual, or we make them hybrid, maybe 2 days a week. So just understand that this can also impact the mental health of your adolescents. So one of the thinking behind allowing sports was to help children kind of re-engage socially, but have the discussion with your child's doctor, especially if your child has underlying medical conditions. Dr. Collins, if you have had COVID-19 once and it wasn't that bad, getting it a second time, will it be worse?
Possibly. It may kill you. It may not. It's the gamble. So, you can't have the assumption, which I think a lot of people, where you say, oh, I got it, it was just like the flu, but then they went home and killed grandmama and it killed her. Or the 18-year-old who died because, remember, we talked about those clots. She wasn't that sick. She was at home. She wasn't on oxygen, really didn't feel bad, didn't really have a cough, no fever, but the clot took her out. So understand there's more to it than that. So you're really playing Russian roulette with this. And so you still, let me say, still be really diligent about it. There's no guarantee that it will be worse. It's not a guarantee that it will be the same. It's not a guarantee that it will be better.
Dr. Williamson, let me just show something about variants. I just looked up variants for today versus when I looked at it a month ago. This is not cute. A month ago, this is the slide. See, it had lots of white space, right? The number of variants was 932 for B117, 9 for B135, 3 for P1. I'm going to switch screens here. And this is it today. $21.02, 49, and 6. This is exactly 1 month later. New York has now gone to 136 of the B117. The last time it was New York.
Right here.
The last time it was under 50.
And you can see from that map that there are states, like you look at Florida, you look at California, where the entire state is populated with variants. And these are the variants that we are aware of as of February. So this picture is ever changing. There's a question, Dr. Burnett, are there any words of caution or advice that can be given to those who have received both doses of a vaccine, and are eager to resume life, quote unquote, as before the pandemic?
Don't. Just that simple. Don't do it. All the vaccine, we'll say it again, All the vaccine is doing is preventing severe disease. It does not prevent the transmission of disease. You could actually be asymptomatic and continue to spread the disease. So wear a mask. They're also talking about double masks. That's the new recommendation. Make sure you are physically distant, 6 feet or more. If you're in an area where you're projecting, using your diaphragm to project, now it's 20 feet. Make sure you're washing your hands. All of the things that we put in place was 2 days shy of a year. 2 days shy of a year still exist and are pertinent.
There's a question, Dr. Collins, 2 shots versus 1 shot, is the ingredient the same?
So the 2 shots are dealing with messenger RNA, and you're not having any type of virus with that. Like Dr. Burnett said earlier, the Johnson & Johnson uses a adenovirus vector for that. And so that's the difference between Pfizer and Moderna versus Johnson & Johnson. So it is the recommendation based on the shots that you're given if you got 2 or 1. It's not one of those, oh, if I get 2, it's better than 1. It doesn't work that way. It depends on the vaccine that you're going to receive.
I'll take this question because this is a common contact tracing question. If someone is COVID positive and has quarantined for 14 days, I just want to let you know that the new quarantine guidelines are 10 days isolation and 10 days quarantine. Are they allowed to be around others if they get a negative COVID result? The same rules apply. You still have to mask to go out. You still have to stay within your own household. So even with having the disease and recovering from it and getting the vaccination, the guidelines are still the same. And I just want to reiterate, mutations and variants pop up when we continue to gather. So gathering, you may have a gathering and you may say it's okay for us to gather. No one got sick, right? First question I would ask is, did you contact trace everybody that came to that gathering for 10 to 14 days out? So how do you know that that no one got sick or no one became COVID-19 positive unless you contact trace? And that is something that we really need to be mindful of. Gatherings increase variants, and gatherings, unless you're contact tracing, you cannot get this false sense of, well, I didn't hear anybody get sick, so I guess we could gather. You don't know unless everybody registered and then somebody followed all those people for the next 10 to 14 days. Someone wanted to know, have preachers been added to the list of first responders? I can speak to that for New York City. The New York State Council of Churches has put out a petition to have pastors, clergy members, ministers be considered essential workers, because we are still going out there, some of us, to do funerals, whether it's at the graveside or limited within a funeral parlor. There is a petition. What I will do is try to get that petition into your hand to sign it, because we do want the status of those of us to become essential workers.
In Pennsylvania, where I am, we petitioned at Harrisburg and got clergy added to the list. So clergy are now 1B in Pennsylvania. There was a time when H1N1 was out, so that's 1998. CDC said that clergy were first responders. So I'm working with CDC to get that reactivated, but the state still has the ability to accept or reject that. So that petition is essential.
There's a question here. Are the vaccine sites connected with hospitals in the event of a crisis or medical emergency caused by the vaccine? Once again, I'll speak for the New York City run Department of Health sites. They are staffed by medical professionals. All of the city run sites have, the biggest thing is EpiPen. If you have an EpiPen, bring your EpiPen, but I do know that one of the requirements for the city run sites, the Department of Health site, be it Long Island or the 5 boroughs, is that they have EpiPens on site. But even if it's a pop-up site, if anything goes wrong, there's 911. But they are being staffed by medical professional. Dr. Collins, if someone is HIV positive, is there any risk to them if they get the vaccine?
That's an interesting question, and I'm going to be honest that I am not clear on that answer. So I would say speak with your infectious disease doctor, but HIV would put you at a higher risk. So I would still consider getting the vaccine.
HIV was just 2 days ago, was just added to the list of chronic diseases that would put you in higher risk category and need to get the vaccine. That was just 2 days ago.
Someone in the chat that you spoke about the many possible side effects of the COVID infection. Has diabetes been found? 2 of the individuals I know became diabetic after having mild cases of COVID. Yes, there is the phenomena called COVID-induced diabetes. And sometimes it can occur months out. Even within the pediatric population, many of you may have heard in the height of the pandemic, the multi-inflammatory system syndrome, where children up to 6 months out of being infected with COVID-19 were getting, they were talking about the purple toes and different things like that, because, you think about it, as Dr. Collins said, it's coming after everything you have in your system. So those blood vessels and arteries, they can get inflamed, they can decrease circulation to the extremities. And so, yes, you can have an inflammatory response. And all of this that we're looking now with the research for long-term effects. We've only been in this for a year. So suffice it to say that as we talk about long-term effects, we're going to be looking at this 2 years, 3 years, 4 years, and different symptoms and this long hauler syndrome. And for those of you, because I know somebody I saw in the chat, if you're experiencing brain fog, have the conversation with your primary care doctor, get a neurologist involved. Just remember that, you have your primary care, and I'm a primary care, I'm not beating up, but then you, depending on those symptoms, get the specialist involved. And if the specialist is not being recommended, request it. That is your right. Hey, I'm experiencing this brain fog. I'm not remembering things. I want to see a neurologist. Maybe I need a CAT scan. Maybe I need an MRI. Because like with anything else within the medical system, a lot of times it calls for self-advocacy, right? Because we place our hands into people that we trust, but every now and then you have to advocate. Dr. Collins,
can I add on to what you were saying a little bit with the brain fog and all of those things? A lot of times in the hospital, we are checking when you have those mental status changes that are acute, because remember, like we said, this is trying to break down everything. So we have people who have strokes after this. And then some of that comes along that once you've had these issues and clots and all of that, that you can have some neurovascular type dementia, or those symptoms that can continue to exacerbate after this. Like Dr. Williams spoke about with the purple toes, we've had to amputate people's toes and things in the hospital because, again, it's trying to shut everything down, and your body is going to try to keep the main things working. It's going to try to keep your brain working. It's going to try to keep your heart working. So it really doesn't care about your big toe. It'll sacrifice that. And And that's what happens. They will turn colors. The first time it happened, and this was at the very beginning of COVID, you know, at first we're looking, thinking, oh gosh, did we lean on their toe, or did somebody put something on it, or maybe the warming blanket? But that was not the case.
Dr. Collins, there's a question. If you are pregnant or planning to become pregnant, should you get the vaccine?
Okay. If you are planning to become pregnant, yes. And if you are pregnant, it is recommended for pregnant women. I would suggest, though, that you speak with your OB-GYN so that they can go through that with you. But yes.
Dr. Burnett, someone asked has there been any documented cases of someone who had COVID-19 and then got reinfected with a variant?
Yes.
Yes. And there are multiple cases of reinfection. So that is why, even if you've had the disease process and recovered, you're still required to get a vaccine, because reinfection has been documented.
Think of it like the flu. We're all used to the flu. Flu has influenza A, influenza B. Every year it changes up a little bit, which is why we get revaccinated every year. But we all know people who got the flu at the beginning of the season and then got it again at the end.
So we are looking, getting ready to wrap up this information session. I want to first and foremost thank all of you for your questions. What I would like to do is allow each of our panelists to just give a wrap up, because I know the basic question is, should we get vaccinated or not? Dr. Burnett.
Yes. My 92-year-old father asked me every day, when we going, when we going, when we going? So we went.
Dr. Collins?
My answer is yes.
My answer is yes. And something I do want to say, for those of us in ministry, we have to not only look at our household context, but look at our ministerial context. Case in point is I go into the jails as part of a ministry that I do. I have an 89-year-old mother at home. I have a college student that travels back and forth from North Carolina. I have a 15-year-old. So you have to not just look at your household context, you look at your ministerial context, because ministry did not stop. The pandemic did not stop ministry. So my answer is yes. Reverend Natalie?
Yes, I recommend that you get the vaccine, but also, and along with that, wear your mask, social distance, wash your hands, and eat healthy food to boost your immune system. That is so important. We are the ones that are at higher risk for giving COVID-19. So we also have to be more committed to making those healthy food choices. And Dr. Lisa, when you talked about looking at our surroundings as in ministry, we also have to take a look at one of the things that we do in the Health Commission. I'll say it this way. One of the things we do is when we see many of you online or others online doing certain things, we are watching. Are you sharing mics? Did you take your mask off? Are you standing too close to someone? When we ask you not to touch someone, why are you fist bumping? Why are you elbowing bumping? You are too close to people. All those things have to be in place. Thank you.
Amen. I am going to yield the floor. I want to thank the New York Conference of Churches for coming together. I am going to yield the floor right now to our presiding elders just for wrap-up remarks, starting with Reverend Presiding Elder McCune.
First of all, I would like to thank all of the presenters, Dr. Burnett, Dr. Collins, Dr. Williamson, and Reverend Natalie Mitchell. I think you did an excellent job on presenting a very difficult subject matter. It's very sensitive in the Black community. This was very enlightening, and I'll be honest with you, somewhat frightening, but it's the reality of it. And this information will give us the power to know to make the right decisions for not only ourselves, but especially our families and children and our churches. Thank you once again.
Thank you, Elder McCune. Elder Owings, would you like to make remarks?
I certainly ditto what Elder McCune has said. I go tomorrow morning for my first dose. It was difficult to get an appointment out here in Long Island. I tried all kinds of things, was on the phone and crazy, and it just happened to be by a friend that was able to get me in. And so I do recommend that if you after hearing this presentation, I pray that all of those who have not yet will, when the time offers itself, you will get vaccinated. Thank you.
Thank you. And Presiding Elder Guyton.
Thank you so much, Reverend Dr. Williamson, and especially to Dr. Burnett, Dr. Collins, and Reverend Natalie Mitchum. You all are amazing. And I just want to take this opportunity to thank our Bishop Gregory G.M. Ingram for fully supporting this initiative, and especially to the senior elder on the New York Conference, Elder McCune, and the newly Reverend Dr. Joanne L. Owings for fully supporting this initiative from day one, giving plenty of input on how we should go forth. This was a huge success, and I especially want to thank all of the pastors who got the word out to the many of you who joined us online. The more educated we are, the safer we become, and that's what this whole initiative was about. And so we don't just want you to keep the information for yourself, but we want you to continue to spread the word, heed the advice of our professionals on tonight. But once again, the services you all provided tonight, the health information coming from those who look like us was invaluable. And to that, I say thank you. God bless you.
Thank you. And I put the Health Commission, the International Health Commission website, all of our webinars and the town halls and the info sessions that we are doing. You can find them. They're being recorded and uploaded. You can go onto the website. If you want to have us come speak at your individual churches, or you belong to other affiliated, we have got to get this information out to our communities. We are available. You could reach out to any one of us, and we would be willing to you don't have to do anything but give your Zoom information, and we'll take care of the rest. And sometimes we bring our own Zoom information also. I want to just take this opportunity to thank everyone, and I just want us to pray out because none of this is possible without understanding what God told us thousands of years ago. People die because of lack of knowledge. Gracious and everlasting God, we thank you, we praise you, we honor you this evening, oh God. We thank you for everything that our eyes have seen, our ears have heard, and our hearts have come to receive. God, continue to strengthen us to bring this information to the people that need it the most, God. Open up ways of resources that they will be able to make informed decisions, that they would be able to get vaccinated, dear God, and that they would be able to protect their loved ones and to protect their communities and to protect the congregations. We bless you in Jesus' name. And everybody, I know if you was unmuted, would say amen. Good night, everybody. Thank you for joining us.
Thank you so much.
Amen.
Very well done. Very well. Thank you so much.
Amen. Thank you so much.
Thank you.
Thank you.
God bless.
Thank you.